Well, as we mentioned, May is Mental Health Month, and our sponsors at Envision Wellness are providing critical psychiatric resources to our community throughout this month and beyond. Take a look at my conversation with some of their practitioners. Well, today we're sitting down with our sponsors at Envision Wellness. I'm here with Moselle and Lori. Ladies, thank you so much for joining me.
Thanks for having us.
Of course. I'd love to talk first about what your role is at Envision and what you do.
I've been in Envision, well, it changed names, but I've been there 14 years.
Nice.
And I provide mental health counsel, well, not counseling, but evaluations with medication evaluation. I work with the clients. I do 2 different clinics. I do a clinic on Vulcan, which is all day from 9 to 5, and then on Thursdays I do a morning at Wellcom where the clients come in for groups. Those are our dual diagnosed clients, and then I'm there from 9 to 12, and then from 12 to 5, I'm back at Vulcan at the clinic.
Okay.
So I see a variety of clients with all different diagnoses. We advocate a lot for the clients. I do a lot of case management with your other providers, being medical, because a lot of the clients have comorbidities, medical. So I reach out to their primaries if they have an issue going on, and developing a real therapeutic relationship with the clients is very important. So they'll tell me what's going on. Are they taking their meds? So that's what, like, one of our struggles is making sure they take their medication. They do also therapy, because I'm a big affirmer. It's just not about medication. It's also the whole gamut of getting their psychotherapy, you know, and looking at their support system. A lot of our clients don't have family members involved, so we link them out with extra supports if they need it in case management. Some of our clients live in residentials, which is either in DePaul or a transitional service thing, so I'll reach out to their staff over there. So it's a whole gamut of working with them with case management.
Nice.
Yeah.
Okay, Moselle, tell us about what you do.
I am the medication administrator. I work at 2 offices also. I work at Vulcan on Tuesdays and Thursdays, and I work at Elmwood on well, I go to both of them on Tuesdays, and then on Thursdays I'm just at the Vulcan office. And I administer the medications that they need that Lori often prescribes for them.
What we do is she administers all the long-acting injectables, so clients that aren't real responsible taking their PO medication by mouth, we get them hooked onto the injectables, so it keeps them stable.
Well, we just heard a lot about what you do, what your day-to-day is like, and even some of the challenges you face with the patients you encounter, but I'd love to learn more about what you enjoy about the work that you do.
I enjoy that I'm helping a lot of individuals in the community that struggle sometimes with mental health, and I know a lot of people that don't have mental health issues don't enjoy taking medication, so I like that I am responsible for keeping a lot of people stable, and then I also have a reputation of not having, being a good shot giver, so I think that keeps a lot of patients coming back, and I think that's a good thing.
That's right. No one likes to take medicine.
No, it doesn't.
Day.
And so I think we love our clients. So it's just trying to keep them out of the hospital and well, and we provide a lot of education for them. You know, I think luckily too with mental health now the stigma's gotten better, you know, which is really great. So it's just teaching our clients, you know, it's just a different part of your body that's not functioning well, you know, and you need the medication. Just like if you had a heart condition, you need to take your medicine, you know, or diabetes. And so it's just educating them. And then I do a lot with their families. The ones that do have families, they'll come in with family sessions with me, or they'll call me so we can keep them well.
Nice.
So we just like to take care of them.
That's right. I know that something people are curious about is if there's a wait list for either of your agencies.
No.
Which is good to know, because when people are looking for help, they need it. They need it now, right?
Yeah, exactly.
Well, ladies, thank you so much for sharing more about what you do with our sponsors at Envision Wellness.
Okay, thank you so much.
On top of the services they offer all year long, our sponsors are also hosting free mental health workshops at the Town of Tonawanda Public Library every Friday at 2 p.m. For more information on these workshops and the rest of the services they have to offer, you can visit envisionwellnesswny.com.